What are your areas of focus in myelofibrosis research?
So I think the way that I would break it down, when you think about myelofibrosis patients or patients with myeloproliferative disorders, patients who are diagnosed and they're really pretty much asymptomatic. And then you have patients who have some symptoms. And then you have some patients who are very symptomatic or transitioning into a more severe disease. And predominantly that disease is acute leukemia. And so I have an interest in trying to identify new treatments for all of these types of patients.
In your opinion, what new myelofibrosis advances are most promising?
So traditionally, for a lot of myeloproliferative disorders, including myelofibrosis, we had a watch and wait approach. So we typically actually did not really have very good therapies. And I think all of that changed with the approval of the first JAK inhibitor, ruxolitinib. And we have transitioned to understanding the signaling pathways that are involved in myelofibrosis and myeloproliferative disorders. And we understand certain driver mutations that are involved in these signaling pathways and involved in other areas that help drive these diseases. And I think what's exciting for us right now is we're transitioning from having a Band-Aid approach or a watching and wait approach to actually having interventions that are what I would call disease-modifying drugs. And so these drugs target some of these drivers that drive the disease. They target some of the inflammation that's associated with the disease. And in fact, they're also targeting some of our own immune cells that may help us protect us against these diseases progressing into more aggressive disorders.
How are innovations in technology accelerating myelofibrosis research?
Think about how we understood these diseases 20 to 30 years ago. I think we understood the clinical presentation. We understood that some patients had big spleens. We understood that those patients' counts didn't do so well. We understood when we would look at their marrow, how the cells looked under the microscope. And we've transitioned to now understanding how some of those proteins that are in these signaling pathways are either turned on or turned off. We have a better understanding of the genetics of this disease and how it changes over time and what that means for patients prognostically and how they will actually respond to our current therapies. And obviously, it's driving how we are setting up clinical trials and other therapies for the future. And so I really would say our genomic understanding of these disorders has really opened up many opportunities for us to treat these patients better.
Well, are there other research developments showing promise that patients should know about?
So traditionally, we've thought about these disorders as disorders where maybe if we improve symptoms, so we give you maybe a pill that would help with your symptoms, or we'll give you another medication that will help with keeping your counts under control or reducing your risk for clotting and stroke. And we are currently in a space where cellular therapy has exploded across all areas of oncology. We have many clinical trials that are using therapies that take your own cells or other donor cells from healthy people, and we are giving them to patients with the hope that it will get rid of these bad cells that are driving myelofibrosis.